प्रैक्टिकल एग्जामिनेशन में हमारे पास जो एग्जामिन जब तुम करोगे एयरवे तो तुमको कुछ टेस्ट है जो सामने से करने हैं एंड फिर उसके बाद पेशेंट के लैटरल साइड में आके लैटरल साइड करना है. तो फ्रंट साइड में विल स्टार्ट विद द लाइन ऑफ साइट एग्जामिनेशन में नोज में टू चेक कि कोई डिवेटेड नेजल सेप्टम तो नहीं है. तो उसके लिए यू हैव टू टेस्ट स्पेचुला टेस्ट एंड कॉटन वेव टेस्ट. उसकी इंटरप्रिटेशन हम नेक्स्ट वीडियो में देख लेंगे. फिर मैलर रीजन देखना है कि उसकी कोई हाइपरट्रॉफी या संकन मैलर रीजन तो नहीं है. लुक फॉर any abnormality in the cheek area which is buccal pad or fat which is less in underlip mostly. Then in the upper lip and lower lip area if there is any cleft. After this we'll go to the lower jaw. उसमें grossly if there is some retrognathia या फिर acromegaly में if there is prognathism तो they are predictors for difficult airway. जब ये चीज़ हमने सामने से देख ली है then we'll ask the patient to open his mouth. ठीक है. We'll check for two things. First, we'll ask the patient to put patient's three fingers into his mouth vertically. And second thing, कि we can use a scale. उस scale में we can measure the distance between the upper incisor and the lower incisor. So this distance should be more than 5 centimeter. And similarly, those three fingers, उसको insert करके दो. If he is able to insert 3 fingers, that is adequate mouth opening. After the mouth opening, we have to use a torch. Tongue protrude कर, ठीक है. So we'll ask the patient to protrude the tongue without making any noise. So phonation is not required, and this thing is required to check Mallampati grading. Apart from the Mallampati grading, we'll look for any ulcer or dryness of the tongue. Any other abnormality in the oral cavity, the size of the tonsils if they are enlarged or not. So internally we'll check for all the structures. उसके बाद front में neck में we'll look for 3 distances in the front of the neck, which is in the full extension without leaning backwards and without pulling up the shoulders upwards. We'll check for sternomental distance, then thyromental distance and the hyomental distance. So these 3 distances are used to calculate in the front side of the neck. Then if we have a measuring tape, then we can measure the circumference of the neck at the most prominent point of the thyroid. तो सामने से हमको ये सारी चीज़ें करनी है. फिर हम आएंगे lateral side में. Now the patient is sitting in lateral position. We have to ask to range of motion of the neck. So the range of motion of the neck can be checked from complete flexion to the complete extension. If you do not have a measuring tape, you can ask the patient to flex his neck as much as he can and touch his sternum. If he is able to touch his sternum, that is adequate flexion. Then we'll ask the patient to extend his neck without leaning backwards. This complete extension we can use a Delinquent test. That is, one finger is put in on the occipital protuberance, other one on the symphysis menti. If after complete extension, this finger on the occipital protuberance is below the finger on the symphysis menti, that is adequate extension. If it is at the same level, it is restricted. And if it is above the symphysis menti, then that is a difficult airway because of the less extension in the neck. Apart from this, we can check the complete range of motion using 2 scales. First, we'll ask the patient to completely flex the neck and put a scale like this in the front of the tragus. Then we'll ask for complete extension. After complete extension, we'll put another scale like this. So this angle which is formed between the 2 scales should be more than 90 degrees for a easy airway. Then there is another term, Atlanto-occipital range of motion. For that, we have to ask the patient to open his mouth, and at the level of the upper incisor, we'll keep the scale horizontally. Once he has done that, we'll ask the patient to extend. After extension, we'll again keep a scale at the upper level of incisor, and now this acute angle which is formed is representative of the Atlanto-occipital range of motion. For the mobility of the temporomandibular joint, उसके लिए there are 3 tests. First one is we'll ask the patient to open his mouth and we'll keep our thumb in between the angle of mandible and mastoid and the index finger in front of tragus. Then we'll ask the patient to open his mouth, open. And we can feel this finger is getting insinuated in the joint. The second thing, we have to ask the patient to protrude his mandible. Protrude the mandible. You can see the lower incisor, they are coming in front of the upper incisors. If they are moving ahead of the upper incisor, that is adequate. If they are at the same level, which is comparatively restricted, and if the lower incisors are even far behind the upper incisor, that is a difficult area. The third test is upper lip bite test. We'll ask the patient that the lower incisor has to bite the upper lip. So the vermilion border, if it is above the vermilion border, that is adequate. At the level of the vermilion border is grade. The next grade in the below the vermilion border is the least one. If the patient is edentulous, the other name for the test is upper lip catch test. When we ask the patient to rotate laterally, there are two other tests for mandible. First is the horizontal length of the mandible, which will measure from the symphysis mentae till the angle, and second is the length of the ramus. If the length of the ramus is less than 4 cm and the length of the horizontal length of the mandible is less than 9 cm, that is a predictor of difficult airway. Rope there.